Hello, my name is Jess, and I'm a nursing instructor. I just wanted to jump on a minute and give some perspective and encouragement and a little bit of real talk here. I'm sure it would be more, I guess, better if I did a cute TikTok or something, but I don't know how to do that. So I'll just stick to this. And I made a few notes, and I just want to go over a few things with you guys. Um, I'm making this not only for my students, but for nursing students kind of everywhere because I think that you miss out on this sort of real talk when you go into nursing school and you just kind of get dropped in there to kind of fend for yourself until someone comes along and kind of tells you, gives you a little guidance. So here I am to do that. So I think a lot of you have already figured out that nursing school, the purpose really is to pass the NCLEX and obviously learn as much as you can about the theory behind how we practice. Um, you're not expected to remember everything. You're not expected to soak up every single detail. We just want you to be able to know the basics and be able to explain to patients why things are going on, why um, you know kind of the explanation behind some of the things that are happening to them. Um, Clinicals are meant to kind of get your feet wet and learn what you can. The real learning is when you're like an extern or a GN. So if you can, I know my program has the opportunity to sit for the LPN board, so I highly encourage that and work as an LPM, work as an extern, do all that to get real experience. During clinical, the preceptors on the floor are not paid to precept you, so I'm not going to say that you get less of an experience, but there's not as much incentive to teach you, and they're busy. So really, the real learning comes when you're kind of one on one with that preceptor that's paid to teach you. Unfortunately, nurses, we want to teach everything, but sometimes it's when we're on the floor, we're super busy and you just have to kind of observe and take everything that you can from that experience. Um, as an RN, you're always going to be learning and growing. Once you get your job, you're going to have a one-on-one preceptor, probably a few different ones, which is great, to learn your role on that floor and learn what you need to know for your job. So in nursing school right now, you're just getting a general, broad, here's what you need to know to be a safe nurse and pass the boards. In clinicals, as a clinical instructor, I'm looking to see if you're a safe nursing student. What I see in clinical is a good kind of representation of how you will likely practice as a nurse. So I want to make sure that you're safe. I've seen a lot of unsafe behavior, and I, that freaks me out because as a real nurse, there's not that accountability. You don't have someone looking over your shoulder. So I really take that seriously. And I want to see if you're using good judgment. That kind of ties into the safety piece. I want to see if you're using critical thinking and common sense, right? So, common sense as far as like how you're interacting with patients, what you're doing, what you're talking about. I want to see that you have good character. As far as studying, it's really important to study. So I think you know that, but it's kind of hard because no one really gives you guidance as far as how to study. And if they do, it's like not a whole lot of people really listen. So I want to give you like a really simple way to study. So I always hear like, oh, the teacher didn't talk about that, or people get all bent out of shape because they're not spoon fed the information that is on the test. But I know that at least in the program where I'm working, my students get test blueprints. So that gives you a lot of information as far as what's going to be on the exams. I know I'm sure it's a struggle for classroom teachers to be able to teach all the information because there's just so much. But there's some things that you can do in your own study time to really just focus in on what you need and just ignore like whatever your problems are, whatever however you're unsatisfied with, maybe your classroom teacher. It doesn't really matter. You need to really just put that aside. That's a distraction for you. Um, and really focus on what you need to study. So, if you remember that AdPi mnemonic, I hate mnemonics because, like, what rabble dabble, what does that even mean? But AdPi, you have your assessment, diagnosis, plan, intervention, and how you evaluate. So that is like a really important mnemonic to keep in mind when you're studying. I know I used to study like I would make care plans for every part of the blueprint, and I would split it up with my study group. So I would maybe take like numbers 1 through 10 on the blueprint and make like care plans as far as um, what's on the blueprint. So you use the AdPi to study. Um, Again, I'm not techie. I don't know how to put in little pictures or whatever, but um, you kind of know, just go into your textbook and pick out, okay, assessment. What's my assessment details? What are the symptoms? What are the labs? What do I need to know how to assess this uh, part of the blueprint? Also, pathophysiology is part of that assessment. I need to know what I'm looking at. So, know your pathophys, know your symptoms, etc. Diagnosis, I think that's more like the lab values and any tests. Um, and then the plan, how you can take care of the patient. So remember the difference between nursing interventions and medical interventions, as well as nursing diagnosis and medical diagnosis. So how you can take care of that patient, and then intervention, what are you gonna do? They got pneumonia, you better make sure that you're making them cough and deep breathe. You better make sure that you're giving them an NSAID spirometer. And then evaluation. How do you know if what you did worked? So AdPi, um, my students, I can work with you on that if you're having any confusion. But and then for the subjects that really didn't click for me, I would find a case study to do, and that would help a lot. And then NCLEX questions. Just do as many NCLEX questions as you can um, pertaining to the test blueprint that you get. It's really important just to do questions. And what I found in my own nursing school, the MedSurg success books that you can get on Amazon, a lot of my teachers would take questions out of there and just kind of rewrite them. So I already knew the answer because I had done so many questions and looked at the rationales. So that's just kind of my perspective to you. Just kind of give you an opportunity to zoom out and see, like, what's the point of nursing school? What's the point of clinicals? And how am I going to study? Because it's important, and it's not the teacher's fault if you fail. I'm just going to be honest with you. You have all the things that you need to succeed, but you just need to implement them. So, and you can do that. I'm here to help. Your instructors are all there to help you. Hopefully, you have great clinical instructors that you can go to and say, "I'm struggling. What can I do to help? Or what can you do to help me?" Um, know also your study, like how you study best. So for me, I used to, well, and I still do for grad school, write my notes, um, speak them into my voice recorder app on my iPhone, and then when I'm riding around in the car, I listen to it. So that's 3 ways to get the information. If I'm really unclear on a subject, YouTube, there's lots of YouTube videos. So really, I'm encouraging you to take control of your education because you're paying a lot of money for it, and I really hate seeing people fail. So that is my words to you. You can do it. Nursing school is just a series of flaming hoops that you have to jump through, and they get smaller and smaller as time goes on. And then eventually you'll be done with it. And So, yeah, you got it. So